Welcome to the What If It's Not Depression Vodcast. I'm Dr. Achina Stein, and I am interviewing today Debi Robinson, who is a certified yoga therapist and health coach. Debi's focus is on teaching tools to counter the functional loss we experience as we age. Her mission is to help people with osteoporosis and to recover from it. At 51, Debi herself had a total hip replacement and understands what it feels like to be handicapped and depressed and what it takes to build up strength and balance in her body and mind and help you in your body and mind. She presently is joining us from her home studio in Los Angeles and is the owner of Debi Robinson Wellness. Welcome, Debi.
Thank you. Thanks for having me. I'm very happy to be here.
Yeah, so tell us about your story with regards to what happened that led up to your hip replacement.
Well, so in my early 40s, I received an injury, and that injury eventually got to the point where I gave up everything in my life. And you don't realize that that's happening when it's happening. I stopped playing tennis 5 days a week. I stopped running 3 or 4 days a week. I stopped spinning, and I stopped all the things I was doing because I would be in pain afterwards. And when it got to the point where even walking became a challenge, like 1 mile into a walk, I would feel throbbing pain. That's when I thought, oh, I got to do something. And I went and had it's called the MRA. When you look into the joint, it's an arthroscopic view.
Mm-hmm.
And I found out that I had a torn labrum, and I had a surgery to try to repair it, and it didn't work. Mm-hmm. And so that caused my joint to collapse. So that's a weight-bearing joint. That's how you stand, how you move, how you live your life. And I was broken. It really broken.
Right.
And so then 19 months later, I ended up having a total hip replacement, and I was only 51 years old.
Yes, that's very young for a hip replacement.
Yeah.
Great. Yeah. So were you already a yoga therapist at that point, or did you shift gears in terms of your work?
Well, a lot of people don't even know what a yoga therapist is. A yoga therapist is 1,000 extra hours of training. And in my program, it was a clinical training. So it's typically when we're going to work more individually with someone, and especially when they have clinical or musculoskeletal conditions. So I started that program because I wanted to learn more about the hip joint or the body. And not only for my own healing and recovery, but for those that I worked with. And I had started teaching at a hospital in Southern California, and my students were 55 plus, and I had a lot of nurses and physicians that were in my classes. So I wanted to watch my P's and Q's, and I wanted to make sure that I kept people safe. Mm-hmm. So I decided to go to yoga therapy. We're trained by doctors and psychiatrists and psychologists and nurses and other yoga therapists and chiropractic and PT. And so it gave me an understanding of the body, and then, of course, the deeper healing aspects of yogic philosophy.
So you're saying a yoga therapist is different from a yoga teacher, like at a yoga studio where you would go and do a yoga class?
Well, yoga teacher training takes 200 hours, and that's not very much. And then to go in, so a yoga therapist, to become a certified yoga therapist, is 1,000 hours of training. And it's so in depth, and you learn so much more about the physical body. And then you also learn about our mental emotional self, the philosophy, this deep healing wisdom of yoga on such an immense level. So I don't even know that I realized, honestly, what I was entering. And it's like you go from thinking that yoga is, this little tip of the iceberg, and then you get into the study and you're like, wow, this is a vast, deep healing system.
Right. Yeah. So I typically recommend yoga in terms of a form of exercise and movement, but also meditation. And so people find yoga for a variety of reasons, but I don't think I ever really thought about yoga in terms of strengthening your body for osteoporosis, and because we were talking a little bit before that, and as well as depression. So I think it all comes together in terms of bringing the mind and body together, really drilling down in terms of doing this work to address multiple issues and not just one issue, right?
Yeah, I think that that's the big thing here in the West with allopathy. We've been so focused on the biochemistry and on the body. And the Eastern practices have this integration and understanding that we are not just the body and that we are not just the mind. And so when you realize that we are this multi-dimensional, multi-layered being, then that opens up so many tools and opportunities for healing wherever you need healing to occur. And that's what's so profound.
Right. So tell us a little bit about how you go about approaching osteoporosis and or depression, whichever one you want to start with.
Yeah. So you start off with a dis-ease or a lack of balance, right? There's whatever that is, whether it's in the biochemistry, whether it's in the mindset layer, or whether it's in the musculoskeletal, in our joints and our bones. So you start off with a dis-ease state. And the goal of yoga is to find harmony and to find balance and to find that Goldilocks position. You know, it's not too much, too little, too hot, too cold. So that's what it is. So you use the physical asana practice to make sure that the body is not too tight, not too loose, not too strong, not too weak. And and then the breath work and the meditation parts of yoga, because, you know, you've got the physical practice that everybody thinks is yoga, and that's a big part. But the actual book that most of us here in the West follow, the guidebook for yoga, is called the Yoga Sutras by Patanjali. And there's 196. They're called slokas or aphorisms, very rich lines of wisdom. 196. 3 of them are on the body, and 193 of them are on the mind. So if we're talking depression, we're going to go more into a mental emotional layer, right? And then we're talking about the osteoporosis. We're going to think of bones, which we could see and touch and feel. Yet there's also so many layers to that. So it doesn't matter what the dis-ease, meaning lack of balance, right? D-I-S, and then ease. The word ease is balance. So wherever you're out of balance in your mind and your body, we use the tools in yoga to balance that. So I do that whether I'm speaking with somebody about the mindset and about managing depression or managing their bone health.
So I know that there's different schools of yoga that are, brought to this country, Vinyasa, and there's Bikram. Is there a particular type of teachings that you have that fall under a particular category of sorts? I'm not finding the word.
Yeah. And that's the thing, Dr. Achina, is that we don't have the terminology here. And that's the thing. So part of my mission, honestly, is to raise awareness of what yoga is and what yoga isn't, and to really expand the awareness, because I really do see it as a huge tool for healing. And I want to raise awareness to what yoga therapy is. There's different types, and some of that is branding. Some of that is the people that came to the West put it in a package that would be sellable to whoever they were selling it to. So I would say that Hatha yoga is yoga of energy and of balancing energy. So I'm going to say that that's like a big blanket term, and then some of these follow under it. And when people ask me what type of yoga do you teach, I say I teach yoga, because I hate it to be I want it to be this vast word that it is. Right. So Hatha yoga is the balance. Yeah.
And that's spelled,
I'm going to say what it is.
Yeah, that's spelled Hatha, just so people.
Yeah. Right? Yeah. And remember, most of these words that we're going to say are actually Sanskrit words. So we're putting them into our English version. But yeah, Hatha. And it has to be ta, ta, ta. The tongue has to hit the top of the palate, because all of these, if you look at the brain, there's actually so many neurons dedicated in the sensory cortex to the lips and the tongue. So when we actually use our mouth, which is what you do with a lot of the, they're called mantras, and the word man means mind, and the word tra means tool. Yes. So if we're talking about adding tools to your toolbox, whether it's osteoporosis or depression, mantras. And when I first started, I'm like, I'm not Hindu. And I thought that it was Hinduism, yoga, which it's not. It's a spirituality, not a religion. And it's actually a science. And I'm not Hindu. But then somebody said, but we have our own mantras. I'm not pretty enough. I don't have enough money. I'm not thin enough. So we have all these things we say over and over. Right. So anyway, Hatha matters because ta, ta, ta is hitting the palate and is stimulating the brain in a way that is meant to be in this communication that we're trying to achieve when we practice yoga.
Oh, that's so beautiful.
So.
I love what you just said. And just talking about mantras, I give my patients mantras all the time to counter all of those automatic negative thoughts. Yes. So finding that mantra, I mean, it's not a Hindu mantra, but it just to counter those thoughts. Like, I'm a warrior, not a worrier. I'm a warrior, not a worrier, right? That kind of thing. So, but
I love that. I mean, they're so lucky to have you, really. So lucky to have you that you're sharing that. I'd love to share 2 mantras or 3 mantras. They're really quick ones. But sure. the drivers of the nervous system, the drivers of chronic stress that break down our body. So when we get to a point of biochemical imbalance, which is disease, osteoporosis, depression, and many other things, quite often that's part of that chronic stress limbic loop that happens. And the stimulation there is either what we're taking in the present moment, what our senses are taking in. It's also from the subconscious brain, from memories, from our lineage, from lots of things, experiences. So the 2 main drivers of that response are fear and scarcity, right? Am I safe? And do I have enough? Am I pretty enough? Do I have enough? Do I fit in? Do they like me? Like all of that. So here are 3 mantras that when I share these with people, and sometimes when I say them myself, I get goosebumps because I think my soul is ready to be, okay, you're right. Yes, I am amazing. So here's the mantras. The mantras, first of all, the first one is, I am safe. I am safe. And if you sit and you close your eyes and you repeat to yourself and you let it wash over you and fully embrace that at that moment, whatever that day is, whatever that time is, whatever temperature your skin is feeling, and it's really good too if you close your eyes, because the optic nerve stimulates the brain about 80% of the information it takes in. So if you are in a heightened state of stress, closing the eyes can allow you to go inward. And if you repeat the mantra, I am safe, that can really give you a nice calming sense. And then the next one is, I have enough. I have enough. And that's going to help with the scarcity. And then the last one that is so powerful is, I am enough. I am enough.
I love that.
And so even just telling you that now, and I'm not closing my eyes because I practice it so often and share it so often, it's almost like my inside soul is like, just took a big sigh of relief, so.
Right. No, that's beautiful. I love all 3 of them. They're perfect. Yeah. What I do is have people change, put Post-its everywhere too, besides just repeating it, just to remind them to see, because some people are visual people, right? Visual learners and visual processors. So having Post-its with those mantras on their computer screen, on their bathroom mirror, it's really helpful. So another favorite of mine is connection, not perfection. Connection, not perfection. So so we can go back and forth with mantras, but I'm so glad you brought that into this discussion, because it is really important to be able to ground yourself and be able to settle yourself in these ways as part of a daily practice. Absolutely. So getting back to yoga.
Well, that is yoga. Mantras are yoga.
Yes, it is. And I don't think people realize that there's a huge mental aspect of yoga. I agree with you. And I personally don't talk about it as being part of yoga, even though it is part of my heritage and tradition. It is something that it's a part and parcel. It's a whole body experience, mind, body, and spiritual experience. Yoga is. So, yeah. So talk about how yoga is really helpful in terms of strengthening your bones, because I do have a number of patients who are, have osteoporosis or even osteopenia. And it is something that's tough to reverse, and having a good yoga practice and understanding that really practicing it on a regular basis can actually strengthen your bones. So tell us more about that.
Okay, so there's three areas that we could be out of balance in the body. There's the mental emotional layer, that's psychological stress, and psychological stress actually contributes to bone density loss. And there are studies out there that have proven that. So that's one thing, is managing the stress, which is huge. And then the next part, the physiology or the biochemistry of bone loss, like happening in the bones, minerals being taken out of the bones or not being able to be deposited into the bones. That biochemical physiological layer, breath work can actually help to modulate body systems. So that can come in. And then also on those two aspects, when you start to feel that you're enough and that you're worthy, and you really start to build up your confidence, you'll start to implement tools of self-care and make better choices with your nutrition, and better self-care to feed your bones and take care of your bones. So there's that part of nurturing and self-care. And then, of course, from the musculoskeletal, that's a big, huge aspect, because bones will get stronger two ways, with two aspects, or two main aspects. They need to have the weight-bearing force. They need to have the demand, the appropriate stressor, and they need to have the protein available and the nutrients available to build the tissue. Mm-hmm. So you have to have the proper diet. And in the sister science to yoga is Ayurveda. And it's also about finding harmony and finding that ease in your system. So finding the proper nutrients. And then from a musculoskeletal aspect, we find joint alignment, which first of all stops bone loss, because when the bones are not in alignment, when you're not in proper alignment, and if you're talking about mental emotional conditions like depression, the postural presentation of sadness or depression is typically more of a forward or a closed off position. So you're going to have malalignment in your joints and in your spine. And when that happens, the body takes minerals out of the bones to lay down more surface area for the place that your joints have gone to. So people don't think of that. That's probably my biggest raised awareness piece for people, is that posture contributes to osteoporosis. People have heard of osteophytes, maybe not osteophytes, but bone spurs. People know that word, bone spurs. Well, bone spurs are the minerals that were supposed to be in your bones are now out of your bones in a spur. So that's happening. So one thing is the alignment aspect, the coordination in the joints, and the posture. So the physical practice is going to help you find that alignment in your joints, raise your awareness to the need for that, and then strengthen the muscles and the connective tissue to keep you in that position. Mm-hmm. So that's that. And then the other part is creating that weight bearing or that compressive or tensile force necessary to create that stimulation of bone remodeling. Mm-hmm. And so that's where the postures, the asana, comes in. And you're either pushing on your bones or pulling on your bones. And the beautiful thing about the yoga postures is you are coming at it from so many different angles, more angles than you ever would in anything else you're going to do. Mm-hmm. So I see it as more beneficial than anything we could do for our bones. You know, you're loading in so many different angles. And I like to say that let's get ready to stress our bones out. You know, we're trying to avoid stress usually, right?
Right.
But no, we need to make stress our friend. And if we think of that we have control over stress, you know, whether that's in our mind or in our body, it's very powerful. So we stress our bones in the proper way. We pull on them and demand on them.
Right. There are definitely good stresses. I mean, you want to stress your body in a good way to stimulate your immune system. It's really important to stimulate growth in the body. So it is important to have some stress in some way in order to, do all sorts of things, not just, physical stress, but emotional stress as well. It motivates you, stress motivates you to do things, but it's when you get overburdened by stress, it's overwhelmed and overburdened, does stress really start breaking you down. I agree.
Yeah, definitely. We have to gently, appropriately expand the boundaries, because if you want your life to be more or bigger or happier, mm-hmm. or stronger, whatever your goal is, you go from the parameters that exist and you want to expand them. So you take whatever it is you're doing and you stress yourself appropriately to get more, to gain more. Mm-hmm. And they call that positive stress actually eustress. EUSTRESS is the good stress.
Right. Right. Yeah. So do you recommend that a person do yoga on a daily basis?
I do. And then that leads us to do yoga. People think, oh gosh, now I got to do something for 20 minutes, 30 minutes. And, when I speak with chiropractors and physical therapists, they say the biggest issue is compliancy. And maybe even for Western medicine doctors in whatever field they're in, the biggest issue is always patient compliancy, actually doing the program you put together for them. And I noticed that for myself because as I was building myself back up, I had gained 30 pounds. The life box I was living in was super small. My boundaries had become so small. It kind of snuck up on me, honestly, because I didn't really realize I arrived there. But anyway, that becomes that boundary became so small. So even when I was putting myself back together, and I like to say, I put Humpty Dumpty back together again, is what I like to say lovingly.
Mm-hmm.
It wasn't about a 20-minute or a 30-minute, even with all my knowledge and all my awareness. It was about my lifestyle every day, all day became how do I build up my body? So what I teach my patients or clients that I work with, because whenever I go into a clinic to do work for yoga therapy, it's patients we work with. It's bite-sized pieces, it's micro movements throughout the day. And so I call what I teach vitamins because I think that we're more inclined to think we're going to take a vitamin. So one of the vitamins I say that we should take all day, every day, at least 3 times, if not more, is called vitamin T for tree posture. And tree posture is a single leg balance posture.
Yep.
And so then I say, okay, so do you brush your teeth? And of course, most people brush their teeth at least once, if not twice a day.
Okay.
Well, you don't need to brush your teeth on 2 legs anymore because you've done that all the time and you know how to do that. You're going to start doing it on 1 leg. And so you start brushing your teeth on 1 leg and then you switch to the other leg. Heating up your tea in the stove or microwave, whatever you do, that 1 minute, whatever, that's going to become your vitamin T time. And I didn't think, you're making your tea and you're going to do your vitamin T time. Oh God, that's going to turn into something else for me now because I'm really into these like little funny things to try to really get it to sink in for people. So vitamin T, I really consider single leg balance to be one of the most valuable things, not only for osteoporosis, for any of us that are over the age that are aging, which means out of our 30s, because the aging degenerative process begins in your 30s. The muscle sarcopenia, the bones osteopenia, and even the mind. They actually even think the mind might start to break down in our 20s, is what I had read. So
So, and why don't you quote that statistic right now? Because you mentioned that before we started recording about the rate of osteoporosis in women.
Yeah, so this is crazy, and it's kind of what I'm hanging my hat on. The National Osteoporosis Foundation has a statistic that 1 out of 2 women over age 50 will fracture a bone due to osteoporosis in her lifetime. And one more statistic, we have a greater risk of fracturing a bone from osteoporosis than we do of breast, uterine, and ovarian cancer combined.
Wow.
So, and then the other thing there is that bones don't break because they're fragile. It's not because you have osteoporosis that your bones fracture. It's because you fall. So my vitamin T single leg balance, I think, is the most valuable pose or posture that we can do. Because to stand on 1 leg, you've got that communication from the feet through the ankle joint, the knee joint, the hip joint. It's going to have to figure out how to calibrate and balance your pelvis, how to arrange your spine, how to hold this heavy head. On average, the average head is 10 pounds on top of your body on 1 leg.
Right.
And you have compressive force at the top of your femur bone in your hip joint, which is the most precarious place to fracture. That's where many people, 50% of the people that fall and break a hip don't survive. So that vitamin T posture is something that I say you're going to take your vitamin T every day. And then the other vitamin that I think is as important, and it's more along the lines of depression and in your line of work, is vitamin G. You have to take your vitamin G every day, and vitamin G is gratitude. And so it is impossible for you to be in a place of gratitude and unhappiness at the same time. We cannot be unhappy and grateful. The brain is incapable of being in 2 centers at the same time. So that place of unhappiness, depression, whatever we want to call all the layers and levels of that, and gratitude, everything we have. So vitamin G is super powerful. And I recommend that people take 3 doses before they go to bed and 3 doses when they wake up, right?
Great.
I'm grateful that I slept, even if you're not sleeping 8 hours, which is going to be so beneficial on many layers. But if you don't ever sleep and last night you had 10 more minutes than usual, be grateful for that 10 extra minutes, right? Find gratitude wherever you could find gratitude, and start to repattern and start to rewire your brain in the gratitude pathways. Because when we're talking about depression and we're talking about neurons and we're talking about the whole wiring of the brain, vitamin G can help you rewire in the happy quadrants.
Right.
And yeah, so
Absolutely.
Vitamin G and vitamin T are my recommendations.
Yeah, I love both of them, but particularly the vitamin T, because one of the things I try to get to do is have my patients incorporate daily habits as part of a lifestyle change, and not because I say to do it. It's finding ways to incorporate daily practices that feel right to you and that you will do on the long term automatically. So when you're at the grocery store, do calf stretches. If you're standing in line for you to pay for your groceries, or if you're pumping gas, do a side leg lift, or a back kick, and just to move as much as you can. Or if you're, just chopping vegetables, to just move your hips back and forth instead of just standing. So anytime there's a place where you're standing or sitting, to try to find some way to move in between and just make it a daily habit, and not feel like you have to go to the gym, and make this formal trip to a gym just to exercise, to try to incorporate on a daily basis, because a lot of times it breaks down. Eventually stress occurs in life, and then what goes? The first thing that goes is the gym, right?
Right.
The gym. So trying to incorporate it into your everyday life is really, really important. So I love the way that you have the vitamin T and the vitamin G. It's really sprinkling it throughout the day is really important.
Yeah. And the thing is that things in motion stay in motion. Like, that's a law of science or physics, right? Things in motion stay in motion. And the other thing is, motion is lotion. And so if your joints to be lubricated, to stay happy and healthy, is so important. And, for those that start to get like out of the 50s, aches and pains are actually something we, maybe before that for some, but really you start to realize like, ooh, I can't do what I used to do, or I don't move as quick as I used to. So like you said, that weight distribution side to side when you're chopping vegetables, swaying your hips to keep your pelvis not so sticky with your lower rib cage. And, the thing is as we age and as we become immobile, there's adhesions in the body, and it's a stickiness. And I like to say it's like cobwebs. And if you think about an attic that has cobwebs in it, the more cobwebs, the harder it is to move through it. These adhesions, these cobwebs, these are actually real things. They're called adhesions. Well, guess what they're made out of? They're made out of minerals. And guess where the minerals came from to make the adhesions? From your bones. So it's one more place that we're taking away. I say the bones are like a bank, and you're either depositing or withdrawing, depositing or withdrawing, deposit or withdrawing. So if you're not mobile, you're going to contribute to withdrawing. And so, yeah, it's all day, every day. It's like exactly what you're saying. It's not, that's how we're going to win this game of life.
Right. I don't think a lot of people realize how much breathing contributes to osteoporosis. And so what people don't realize is that calcium is used to change the pH of your blood. It changes the pH of all the fluids in your system. It's used to actually alkalinize your system. And so if you are hyperventilating, there's this process called metabolic alkalosis and metabolic acidosis. And so there are systems in place to keep your pH very, very in a narrow range. Breathing is one of those ways, and calcium, dissolution or, removal from the bones and into the bloodstream is a way to keep that pH stable, you know.
Yeah, exactly. So the two main pathways of detoxification, the two main pathways that help to maintain that 7.35 to 7.45 or 7.34 to, it's such an intricate, small range that our blood pH has to be in, right? And the regulatory part of the brain uses respiration. So respiration is a big part of that. So breath regulation, which is also going to relate to cardiovascular, because the blood is going to, the heart's going to be related to that as well.
Absolutely.
And then the kidney aspect. So the two main ways that the body does that is through the lungs and the kidneys. And the aspect of the kidneys, the filtration process of the buffering system of the kidneys to balance that metabolic acidosis, is using the minerals that are in your bones. So you're going to be withdrawing, dissolving bone tissue to bring those minerals into the bloodstream. So that's where diet becomes important as well, like making sure, and you cannot alkalize or alkaline your body with diet. Yet you can contribute to the acidity with some of the food choices. But yeah, we need to keep the minerals in the bones. And so breath, yes. Breath, I'm going to say, you know, if we're going to look at, oh gosh, could we pick out one tool in yoga? Because yoga is physical, it's breath work, it's meditation, it's mindset. Like there's an 8-step approach in that book I told you, the guidebook. It's got an 8-step approach. And that's what most of the modern yoga teachers here in the West follow. That most of them do follow that pathway. And of course, no black or white, everything is gray. There's other options, but that's what the majority follow. The first 2 steps of that path are mindset. That's the way that the way we show up with others, the way we show up to ourselves. Then you've got the asana, the physical practice, because you're trying to ground the mental energy from a place of high energy into the body. You're trying to move from the subconscious brain to the conscious brain and take control of your mind. And then you've got breath work, and pranayama it's called pranayama because it's managing your life force energy. It's not just breathing for breathing. It's like you said, it goes into the biochemistry, and it goes into that balance of our blood pH and our internal environment.
Right. Absolutely. Yeah. So, wow, we jumped all over the place. What haven't we talked about?
Well, that's yoga for you, and that's my
yoga
goal.
for you.
Honestly, that's yoga. It's let's say it like it is. Let's share what it really is.
So how would you, let's connect the dots for people in using movement to manage your emotions.
Okay. So that's a great question. You go from the brain to the body. You go from the place of thinking to the place of feeling. And I learned this from Dr. Richard Miller, PhD psychologist, who has a program called iRest that is taken from Yoga Nidra, which is body sensing. So when you cannot be in the place of thinking and feeling at the same time in the brain. So when you go into the physical body, you move from the mind to the body. It's like you take an elevator from where you are all the time thinking. And even if you're either consciously thinking, actually actively, or your brain is in the background processing. And so you come into the body, you ground your mental energy. And that can be really profound, because what it does is it gives you control. It gives you hope when you start to realize that you have that control. It gives you management tools for your physical body, for your mental body. And if you think about the mind like a wild horse, when the wild horse bolts, when horses take off, it's called bolting. And they're prey animals. So whenever they're stimulated by their senses of fear, they take off. When they take off, think about all that action and the 1,100 pounds of muscle that's happening. Well, when your mind is going in that stress response, there's a lot of physical reaction taking place, right? It's like the whirlpool part, or a person who's doing the egg beaters to stay afloat under the water. You can't see it, but it's all happening. So when we go into the body, we actually are now grabbing the reins. We're actually sitting heavier in the seat. We're actually allowing our body to move with whatever's happening. So it's a way to ground your mental energy and to take control over what's happening to you in that moment. It's so powerful. And I'm going to say that for mental mindset control, it's probably the most powerful thing you can do when you're in a place of anxiety and then eventually panic and some of those, bigger take control emotions that are hard, that take control of us.
Right. To move. To move.
Yeah.
In short. Yeah. Wow. So this is all really great information. I'm so glad that, you've come to share all your knowledge about this. It's really extensive in terms of yoga and how movement can help you with osteoporosis as well as depression. I know we talked a little bit about ancestral baggage and the contributors to who we are in this life and how we overcome this. It's maybe not directly connected to what we are talking about, but I know it's connected indirectly. Because we were talking about it. I don't know how it came up earlier, but I would love for you to even just mention that, because I don't think I've had anyone talking about ancestral baggage yet on my podcast. So it would be great if you can just talk about that a little bit too.
Well, I would love to that's where I really want to learn more and share more. But here's what I would say is that you came from your mom and your grandmother. You also came from your great-grandmother, your great-great-grandmother, great-great-great-great-great, right? We came from our first century grandparents and our second century grandparents. And whatever they had to do in whatever part of the world that they were in to survive, they survived, right? My parents are Scottish and then eventually before that Irish. Well, I think the Black Plague wiped out a third of the population. So I know that we survived that as people, right? Mm-hmm. So wherever you came from, whatever your people survived, that became their nervous system, which became their children's nervous system and their children's nervous system and their children's nervous system. Mm-hmm. So the nervous system that we have today is from where we came from. Mm-hmm. And there's and that feeling of fear and scarcity, those triggers or stimulations, we're going to react according to how our nervous system is, our patterns and our conditions. So there's the conditioned life of this lifetime, and then what we bring with us. So the place in the brain where a lot of the stress happens, the subconscious brain, the limbic loop where the stress happens, it's invisible and it's subconscious. It's not in our control, so to speak. That is happening in the background all the time. So when we talk about mood, we talk about how we're showing up in this life in our moods, whether it's, whether we have depression or happiness or whatever it is, wherever we are in that, there's a conditioned part to that. So when you raise awareness to that, you could start to release it, because if it no longer serves you, you don't need to survive the saber-toothed tiger from the ancestry lineage that you have here, or the poverty from here, or the persecution from whoever overtook your people in the fifth century, or whatever that is. So when you start to, I like to look at it as anchors. So when I work on overcoming whatever I need to overcome, like the lack or the poverty or whatever it is that's been a part of my lineage, I actually visualize it as an anchor. And I even do this with my fingers. I take my fingers and I actually visualize that I'm going to cut that which no longer serves me. Because in this year, in 2021, where I am in my life right now, I don't need that safety. I don't need that preconditioned mindset piece. So I'm constantly releasing that which no longer serves me. And the way you can do that is you start to become a witness to yourself. So when you talk about depression and the mental emotional, the really heavy mental emotional disorders, diseases, whatever we want to say about them, call them, when you get to that, this is where you can really do some deep, deep work to overcome that. Because the ultimate goal of yoga is liberation from suffering. And if you're suffering, you want to liberate. So if you can become a witness and actually take yourself outside of yourself. So when I'm experiencing something and I feel the burning or the heart rate or the something in my gut or whatever, I actually think of that I'm standing outside myself, looking at myself, experiencing what I'm experiencing, because then I don't feel it anymore. Right. And when I do that, I can then intelligently decide, is this serving me? How should I respond versus react? That gives you the opportunity to respond to things instead of reacting. And when you can make that shift, when you can start to not react to everything, oh my God, she said what? They did what? Oh my God, again, there we go again. When you can stop that and you could be like, okay, why is this happening? Right. And then you start to detach from your reactions to things. Right. That is how I am liberating myself from the suffering that is part of my lineage or part of what I've experienced up until this point in my life. And I noticed the shift and change in Debi today to Debi before she learned about yogic wisdom.
Right.
I see it and I feel it and I know it. And I see so many people suffering, and I want to say, please, suffering is a choice. Here's
Right.
the information, implement it, and
Right.
stop suffering.
Right. Yeah, you described that very, very well. I perfectly, actually, really perfectly. And everything that you described is also, these are also tenets of psychotherapy when it's done properly. When it's done properly, that's exactly what you want to do, is to stop reacting, step outside of yourself, and notice how you are reacting, and changing it to responses, and making some choices around it. But it does take that stop of reacting. And sometimes people are reacting because they're in fight flight and they're stuck there. So there's definitely a lot of tools out there if you're feeling stuck. And I'm so happy that you were here to share your tool of yoga therapy, and how you connected the dots, and how that helps with osteoporosis or bone loss, and even depression. So thank you so much for sharing your knowledge. And I love your passion around all of that. And I will share in the show notes how people can contact you. And I think you said that you were going to share a meditation of sorts, and you gave me that link, which I'll put also in the show notes. If I remember correctly, a breathing technique that you like, right?
Yes,
So
yes.
I'll include that in the show notes as well. So thank you so much, Debi, for joining us today. I really appreciate your time today.
Yeah, thank you. And thank you so much for having me. It was great to be here.